Hi April, I'm Alex. I'm going to be your physical therapist today.
Okay.
So I understand that you have a bulging disc problem in your lumbar spine, your lower back there.
Yeah, it's been hurting. I've been getting some pain in my leg too.
Okay, so just in your leg or anywhere else, like in your lower back
I would
as
say
well?
lower back,
and
and
it goes
then
down
it goes.
your leg?
Yeah.
Okay, awesome. If you could rate your pain on a scale of 0 to 10, what would you say? 0 being no pain, 10 being the worst possible.
I would say just like sitting and not doing anything, I would say it's about a 5, but if I'm like really busy that day and stuff, it's probably about a 7 at the end of the night.
Okay, how about when you're laying down? Is it worse or?
I would say it's probably about right around a 5 or 6.
5, okay. Alright, so I'm thinking today we'll maybe try some lumbar traction. So we're just going to be putting you onto a traction machine, and it's going to maybe relieve some of the pressure on your disc. It should help out with some of your symptoms. Some other things that we could use this for are like muscle spasms in your back, decreased mobility in your joints, inflammation, compression of nerves. So if you have any questions, let me know, and then I just have some questions to ask you before we get going on this.
Okay.
Have you had any surgery on your back recently?
No, I haven't.
No? Okay. Any injuries in the past week?
No.
Okay. Have you been diagnosed with rheumatoid arthritis or osteoporosis?
No.
No. Okay. Do you have a history of cancer?
No.
May you possibly be pregnant or trying to be pregnant at the time?
No.
Okay. Awesome. How about claustrophobia? Do you ever get claustrophobia?
No, I think I'll be okay.
Okay. And then do you have problems with laying down on your back for more than 20 minutes? Be uncomfortable?
20 minutes will be fine.
Okay. Cool. Next, I'll have you stand up, and I just want you to, if you could possibly remove your shirt.
Yep.
Awesome. Thank you. Okay, so turn around for me. Go ahead and lean to your right. Okay, and now to your left. All right, good. Let me just look at your back here. Go ahead and lean forward a little bit. Any pain with that?
No, not really.
Okay. I'm gonna test your sensation, so I just want you to let me know where you feel me touching.
Okay.
Okay? You can respond with like upper back, lower back, left or right.
Okay.
Okay?
Right upper, left lower, right lower, left upper.
Alright, thank you. Alright, now I'm gonna check your heart rate and blood pressure to make sure everything's okay there.
Okay.
So everything's good? Alright, so let me just warn you about some things that could happen from traction. Your symptoms could increase, the pain could get worse, you could get more pain after the treatment. We're going to try and keep things pretty gentle in like a low traction settings, and we're not going to do it for very long so that none of those things happen. Does any of this make sense?
Yeah.
Okay, do you have any questions?
Mm-mm.
Alright, let me show you how the machine's going to work. You're going to lay down on this, I'm going to strap you into these harnesses, and then the machine's going to give you a pull on your lumbar, and you'll be anchored down at the top so it kind of stretches you out a little bit.
Okay.
And then I'm going to press a button and it's going to start doing it. I'm going to give you a stop button so that if anything feels uncomfortable throughout the treatment, you can press it and it'll stop everything. Do you have any questions about how this is going to work?
Well, I do have a question. How is it going to make my pain go away?
So what it's going to do is it's going to kind of stretch out your spine to relieve some of the pressure on that disc that's making it bulge out of your back, and it should relieve some of your symptoms.
Okay, that makes sense.
Okay? Alright, do you feel up for trying this today?
Yep.
Okay, let me get you set up. Go ahead and lay down on the table. Alright, how much do you weigh approximately?
130, I'd say.
130? Okay. So, let's see. Do the math on this, because I have to do 50% there. Okay. So we're going to do this for about 20 minutes, and I'm going to get you a bell to ring if you need anything. Let me get you all set up and get your bell. Alright, I'm going to have you go ahead and let me remove this for just a second. So I get you all ready here. Alright, you can put your feet flat. Can you lift up your, thank you. Right, can you scoot down towards me? Don't have anything, actually this belt might be an issue. Do you mind if we remove that? Thank you. Centered. I'm going to tighten this now, and
Okay.
you should let me know if it gets too tight. We want to make sure it's tight enough. Is that tight?
Yep, that's tight.
Okay. Alright, put this on. Alright, now that you're all set up and ready to go, do you feel comfortable?
Yes.
Alright, we're going to get started. Here's a bell in case anything gets uncomfortable or if you need to call me. And then here's the stopper machine, so you can press that and it'll stop the treatment.
Okay.
Alright, I'm going to set you up here. We're going to do 60 seconds on and 20 seconds off. And I'll set your poundage here. Since you told me you weighed 130, we're going to start you off at a max of 32 and then a min of 16.
Okay.
Alright, and since you've done this before, we're going to do intermittent, so it'll be on and off, like I said. And we're going to do this for about 20 minutes, okay?
Okay.
Alright, here we go. Unlock the table. You starting to feel it a little bit?
Yep.
Alright. Alright, is that comfortable?
Yep.
Looks like we got about a good amount of space here. I'll come back in about 5 minutes and check on you, okay?
Okay.
Okay, it's been about 5 minutes. Is everything feeling okay?
Yeah.
Alright. It's not too tight. Good there. Alright, is everything comfortable here?
Yeah, it's fine.
Good. Alright. I'll come back at the end of the treatment, okay?
Okay.
Alright, everything's done. Everything feel okay?
Mm-hmm.
Alright, excellent. sit up. Okay, how's your back feeling?
It's feeling better. I
Alright.
say it's probably about a 3 now.
You're at a 3 now? Alright, excellent. So, we definitely decreased your pain, that's good. And how about, is you still feeling some down the leg a little bit?
Just a little bit,
Just
but
a little
it's definitely better.
Okay, good. Alright, so we'll continue to do maybe lumbar traction a few times a week at your appointments. I'll also show you some exercises you can do at home to improve posture, help with your symptoms between treatments. You can, like practice getting your shoulders back and maybe straighten your spine,
Okay.
and I'll see you again later this week
Okay.
on Wednesday.
Sounds good.
Alright, thank you.